Hey everyone. So what I'm going to talk to you about today is PCOS. Now, in our mom community here on YouTube, we hear a lot about PCOS and our fertility with women who are trying to conceive. I have PCOS. I got diagnosed with it in 2005. No. Yes, I did. 2005, after I had Parker, which plays part into why Trevor and Parker are only 21 months apart, and then Parker and Jackson are 5 years apart. But something we don't hear a lot about women talking is PCOS after trying to conceive, and when they are no longer trying to conceive. And I think sometimes a lot of women only think of it as a fertility issue and nothing else other than that. So if you are not trying to conceive and you have PCOS, it just doesn't matter and it's not an issue. But it really, really does make a difference. So I'm going to kind of talk about some of my struggles with PCOS and what I'm doing and my thoughts on it. And I hate it. I'll put that out there right now. I hate having PCOS. It is a pain in the butt. So with my body, I produce way too much insulin. I struggle with low blood sugars, and the thing that I'm having trouble with PCOS is it regulating all of that. And for women who are trying to lose weight, we all know sometimes losing weight can be a little tricky, it can be difficult or whatever, but women with PCOS have a really hard time losing weight. Now, I know for me, I could have months where I'm eating everything I should according to me having polycystic ovarian syndrome. I could be exercising the way I'm supposed to, and then when I step on the scale, I gained pounds. And it's really, really discouraging, and that is just so frustrating to me. My biggest issue with PCOS is weight and trouble losing the weight and weight gain. I steer clear of like the pastas if I can, starches, breads, things like that, because my body just simply cannot process them. I know that people without PCOS have a hard time processing those things too, but women with PCOS have an even harder time. Their body has a harder time regulating everything and processing those things. So those are like things you should absolutely, unequivocally steer clear from, especially if you have polycystic ovarian syndrome. Now I know some women will have like male pattern baldness. They'll have facial hair. Their voice can deepen, weight gain. I'm trying to think of all the things that can go along with it. Luckily, I just have the weight issue, but I know that there's others that have the other things too. So it is really frustrating. And when you go and talk to your doctor about it, their tip to you is to lose weight. Now, that's the most frustrating part, because I almost want to grab them by the face and say, hey, I'm trying here. I'm really trying. I'm not just being a lazy slob that, I'm trying, So to help your PCOS, it's proven that to be a healthier you and losing some of that extra weight helps alleviate some of the symptoms of PCOS. The problem is getting there, because it seems like this never-ending cycle, right? PCOS causes you to gain weight. It makes it harder for you to lose weight. You need to lose weight to help the symptoms. The more weight you gain, the worse your symptoms are going to be, and it just goes on and on and on. So I don't really know. I do know I am losing weight slowly. It's just a constant battle with me. I have to work so hard at it, and it seems like I'm doing all this work for very, very little rewards. But I'm going to keep going because I know it's what my body needs, and I really, really want to be healthy and active, and I don't want to constantly be thinking about how PCOS is affecting me. I want to own it and be in control of it. I don't know. And I do know that sometimes it can go into like a remission type thing or whatever. I had that shortly after I had Jackson, but my cycles went away, and that was that. So I do notice with me losing some weight, I have gained my cycles back. Weight loss is going extremely slow this time around, but I'm sticking to it, and I'm just gonna keep going through, and but like I said, I know in our community here on YouTube, a lot of women talk about it in aspects to trying to conceive, and I'm here to say it is really a struggle when you're not trying to conceive too. It has caused me, and I can honestly say it has caused me some body image issues and frustration, and I just get really upset about it. But I think I'm done being upset about it, and I'm going to own it. I'm just going to go forward, and and I think one of the frustrating parts for me is, like, if I'm talking to family members or friends or whatever, and we get on the topic of weight and our health or anything, and if I do mention that I have PCOS and it's making it difficult for me, I feel like I'm making excuses for myself, and you can almost see it in their face, like, maybe it's just me because it's in my head, but it almost seems like they don't believe that it's causing that. And in my mind, I'm thinking, yeah, sure, they're probably thinking I'm sitting at home eating a box of Oreos every night, snacking on chips, and that's just not the case. So for all of you other women out there with PCOS that are on a weight loss journey like I am, I commend you. It's not easy. I understand that. It's a tough road, but we can do it, and we can, maybe motivate each other, and, don't feel so bad and hard on yourself like I do. I'm getting past that now. I'm starting to improve on that end of things, but, So anyway, that was a really rambly 6-minute video, so I'll let you go, and I'll talk to you soon.